Good morning, my name is Sherry McGinnis, and I am an LPN to BSN student with Indiana State University. Today my presentation is going to be on Community Emergency Preparedness. This is a brief brochure on Community Emergency Preparedness. It just goes over some of the possible disasters that you could be exposed to and what you can do to help prepare yourself and your community for these disasters in the future. The learning objectives for this presentation will be to discuss the areas of importance in planning for emergency preparedness, increase the knowledge base on necessary steps to achieve readiness, increase knowledge base on the types of possible disasters, and increase knowledge base on additional resources that are available to provide not only information but can help greatly during these disasters. Before we get started, we're going to take a quick pre-test. This is a simple 10-question test on emergency preparedness. Questions 1 and 2. Questions 3 and 4. Questions 5 and 6. Questions 7 and 8. And questions 9 and 10. So did you know that more than 50% of U.S. adults have at least one chronic disease and are at risk for being affected by large-scale disasters? Community readiness and preparedness are important factors in ensuring that the people and community are able to not only survive the disaster, but rebuild and prevent repeat events. There are two main categories of disasters that they're classified into. The first is internal disasters, and the second is an external disaster. These disasters can affect people on many different levels. Internal disasters are disasters that pose a threat to the health and safety of patients, staff, and visitors. Some examples could be a fire, a power outage, tornadoes, hurricanes, flooding, bomb threats, radiation, or acts of terrorism. External disasters are disasters that take place near the community. These types of disasters typically leave a large amount of casualty and others who need immediate medical attention. A train derailment or a plane crash are two examples of an external disaster. Most times after a disaster occurs, the organizations in the community typically are the first ones to provide assistance. These organizations are also tasked with designating resources and designating emergency funding in order to continue to provide service. Some important areas that should be focused on with an emergency management plan are to set up emergency communications, have emergency notification system in order to be able to reach out to the community, have an inventory of emergency resources, make a plan for volunteers, and allocate emergency funding. Emergency preparedness planning must make sure to take into account what it would take to increase and improve the resilience of the community, as well as to plan to improve response capabilities. Community emergency preparedness takes a lot of different components to work and be successful. One of the important components are the primary care clinics. These clinics play a huge role in helping to maintain healthy communities. They are typically the first place a patient will present to when they are experiencing non-specific symptoms such as a cough or a fever. By doing this, the primary care clinics are able to screen and identify infectious and contagious diseases, as well as isolate those patients and help prevent the spread throughout the community. When thinking of possible emergencies and their outcomes, the community must take into account some of the things that help to ensure the community is able to handle the disaster and bounce back from it. Some of the things that should be focused on are healthcare, food and water, countermeasures, recovery, preparedness and response, as well as resilience. Another large part of the community preparedness are community and faith-based organizations. They help to provide support and critical services during the disaster recovery period, such as providing funding, assistance with rebuilding, and helping to provide educational materials for children who lost their schools. Sometimes communities are required to evacuate to avoid dangerous situations with natural disasters. Improved communication and safety education discussions before a disaster occurs is the best way to increase the community's trust and confidence in doing what needs to be done when the time comes. Making sure that there is adequate community staff to help ensure these steps are not missed also plays a big part. Communities also need to make sure they are able to address problems such as racial equity, language barriers, and financial abilities. From a public health perspective, emergency drills are a great way to help the community ready and prepare for whatever may happen in the future. Previous research suggests that disaster preparedness drills that take place in community settings are an effective way to create and/or improve emergency plans and how to activate them, the roles of staff, and how to participate in a coordinated response to the disaster. The CDC Center for Preparedness and Response actually has a toolkit with information regarding personal health preparedness and how to build an emergency supply kit. Below is the link where you can access that information and get the information you need to start your own supply kit. The toolkit's instructions tell the individual to put things in their kit such as food and water, personal needs for physical, mental, and emotional health, an emergency supply of your medications, both prescription and over-the-counter, as well as any medical supplies that may be required, important paperwork or documents such as medical coverage and identification, and of course a backup source of power for your mobile phones or any medical equipment. Emergency preparedness is the best way to make sure that you are able to care for and protect yourself and your family in the event of a disaster. Large-scale disasters such as hurricanes and flooding can lead to widespread damage and destruction, causing long-term problems with power outages, food and water, shelter, and strain health resources. FEMA recommends that a typical household have a 3-day supply of food and water on hand, and it's been estimated that at least 20% of homes do not have the recommended amount of stored food or water set aside. In addition to that, of the homes that are prepared with the 3-day supply of food and water, 75% of those homes said that they went through their food and water much faster than anticipated and also ran out of some of their medications. Disasters affect everyone, and everyone needs to be prepared by making sure to have all the necessary supplies, and then some as reserve, in order to make sure that you'll be able to care for yourselves appropriately. Take into account where you live when it comes to preparing your kits and stocking up on essentials. Certain locations, such as islands, are more likely to experience difficulties in getting resources such as food, water, and medications due to interruptions in supply. Here are some examples of community emergency events: blizzards, droughts, earthquakes, tornadoes, hurricanes, things like that. Some of them are common ones: pandemic, blizzard, power outages. And here are some additional resources where you can find some information on emergency preparedness. And lastly, it will just be a review of those 10 questions you took earlier. Questions 5 and 6, 7 and 8, 9 and 10. Here are my references. Thank you for listening and have a great day.